This is Congressman Kevin Brady. I'm here today in Washington with Senator Tommy Williams of Texas, one of the leaders of the Finance Committee, and he has the latest information on what impact that this Senate health bill will have on our Texas budget.
Well, first of all, let me thank you for your leadership and for helping me get the message out to our Texas congressional delegation. I really do appreciate it, Congressman. I asked the Commissioner of Health and Human Services to analyze President Obama's proposal, and what he's told us is that it would represent an unfunded mandate on the state of Texas to the tune of $24.3 billion over the next 10 years that it would take to implement the bill. That would be devastating to our state budget. We're already facing, as we go into this next biennium, a revenue shortfall of somewhere between 11 and 17 billion dollars. We've managed the state's finances so that we can handle that. We think we can manage that. But of that $24 billion, if we had $3.5 to $5 billion of it that hit our budget next year, which is about what I think it would be devastating. We'll have to cut public education, we'll have to cut public safety, we'll have to cut highway construction. So there's no room to raise taxes in the economic environment that we're in. Not that I would be inclined to support that. There'll be no choice except to cut vital state services.
So Texas, which has balanced its budget and created a rainy day fund for tough years.
$11 billion, that's how we're going to get through this next biennium.
Now could be damaged because of a health care bill Texans don't want. Would have a huge impact and doesn't lower health care at all.
You know, that's the most frustrating part about it, is this proposal is not health care reform. Like you, I support meaningful health care reform. But when I look at this, this is an expansion of Medicaid. This is the existing program made bigger. And, you know, the worst part of it is $11 billion of expenditures that they're going to make us pay on people who aren't enrolled in Medicaid right now. So there's not going to be any new federal money on that part of it. And so they're kind of hiding the ball on us a little bit here.
Senator, thanks for your leadership and other great reasons why Texans, both parties, ought to be fighting against this.
That's correct. Thank you.
Thanks,
Appreciate it.